Our next topic here on Sports Medicine Weekly, marathon training, new runners out in the field. Dr. Nick, you seeing that in your office? Because you know what? We feel like it's spring. Every now and then a snow shower will hit or a snowstorm in the Chicago area like we've seen recently. But for the most part, people are outside running again.
Yeah, fortunately, we're starting to see that, right? Chicago in the spring, you wait 10 minutes and the weather's going to change and potentially there's a chance to get outside. You know, fortunately, what we see is not so much the running injuries at this time of the year because people are feeling good. They're just starting to get back into it. Where we really see the running injuries come in is August, September, particularly as we get close to marathon events where people are really getting that high mileage in their training. And it's a difficult problem to treat because this is the definition of an overuse injury, right? All of these injuries occur because somebody is running too much or potentially has some flaw in their running mechanics or a shoe problem, et cetera. And they're very hard to treat because really the mainstay of treatment is you got to stop running for a period of time, which is not what many of these athletes want to hear. So I'm really interested to speak to our next guest about how do we prevent these injuries before they happen, because that's really the key to staying healthy as a runner.
Our next guest is Maria Kronk from IvyRehab. She's the clinical director and physical therapist for IvyRehab and based out of Lisle, Illinois. Maria, thanks so much for joining us here on Sports Medicine Weekly.
Thanks for having me.
All right, so someone's new to running. All right, we're going to start with that. Maybe not a marathon runner yet. How much should they increase their mileage per week, and how many days a week should they run?
Yeah, so a safe percentage to increase per week is right around 10 to 15%. I usually advise the new runner to start on an interval training program, meaning a walk-to-run program, starting at about a 4-minute walk and a 30-second to 1-minute run. And then you can increase that 10 to 15% per week, running about 3 to 4 days per week in the beginning.
Maria, you know, one of the things that we see is people who are trying to get healthy and just starting a new program that involves some form of aerobic exercise. And those, in my mind, are the ones that are really at risk for these early stress injuries, either stress reactions or even stress fractures at time. What other things do you look at in terms of a runner and from their body mass index to other health issues? How do you counsel them in terms of all the things that we should consider before starting a program like this?
Well, I definitely like to see some sort of strengthening program or cross-training program in conjunction with initiating a return to run program or a new run program. I think very few people in this world are able to stay healthy running 6 to 7 days per week, and all they're doing is running. So I like to see some sort of cross-training in their program, whether it's some cycling or some swimming or some type of core and lateral hip strengthening. Those are things that I really like my runners to incorporate into their weekly routine.
Maria Kronk is our guest from IvyRehab. I'm Steve Kashul with Dr. Nick Verma filling in this week for Dr. Brian Cole at his Sports Medicine Weekly. Always the interesting question, Maria, that everyone has. Should we stretch before or after we run? I imagine both.
Yes, you know what? That's a great question. I love to see some dynamic stretching or stretching with movement before initiating that cardiovascular activity. So, you know, whether it's bringing high knees to chest or some sort of variation, even a little bit of skipping or hopping. Before you start running, I also encourage kind of easing into that race pace or the pace that you're gonna that you want to run at. Start at a slower pace for a good 3 to 5 minutes, and then ease into the pace that you want to be running at. And then the nice static stretching after you run. For runners, it's really important you're holding these stretches for at least 30 seconds, doing 2 to 3 repetitions at minimum on both sides. I love to see good hip flexor stretching, gastroc or calf stretching, hamstring stretching, all your hip rotators, in order to stay healthy.
That's great advice, Maria. You know, the other question that I get a lot in the office is shoe wear, either as a potential cause of some overuse injury while running or potentially to prevent some overuse injury while running. What advice do you give new runners about proper shoe wear as they start taking up running?
Yep, definitely. Another great question. So obviously, you can have someone look at the shape of your feet to help counsel you with the type of shoes you might want to be in, whether it's more of a motion-controlled shoe to prevent overpronation or your foot kind of caving in, cushioning shoe to prevent a lot of pounding on the outside of your foot, or a neutral shoe that might offer all three, or kind of a combination between those two. But running shoes are designed to last a while, so I'm always hesitant to blame the shoe if the runner has been in that shoe for a while. So if someone develops an injury shortly after changing footwear, like a week or two, I think it can be plausible to look at the footwear and think that there might be an issue. Otherwise, those running shoes are designed to last about 300 to 500 miles. You can also look at the sides of the shoes just to make sure that you're not seeing excessive drying out or cracking. But otherwise, if they've been in that type of a shoe for a while without having an injury, chances are it's not related to the shoe.
Great stuff, Maria. Finally, I know you got a big event coming up on Thursday, June 13th, and it's kind of an association with Midwest Orthopedics at Rush. Can you tell us more about it?
Yes, we are having a presentation at the Dick Pond in Lisle, Illinois. Dr. Jeremy Allen is going to be presenting along with me, and we're going to be talking about stress reaction versus stress fracture, how to know the difference, and the implications for the runner. So all ages and running abilities are welcome. And it should be a great event. It's at 6:45 on Thursday, June 13th.
Wonderful. And IvyRehab, IvyRehab.com is your website. Maria Kronk from IvyRehab. Maria, thanks so much for joining us here on Sports Medicine Weekly.
Thank you.
We're back with more Sports Medicine Weekly conversation and our staple of the show. It's our Ask the Doctor segment. Stay with us. You're listening to Sports Medicine Weekly only on 670 The Score.